Hello, and welcome to Straight Arrow Equine. Today, I would like to give you instructions on how to examine your performance horse for lameness. What is lameness? Lameness is defined by Merck Veterinary Manual as an abnormal stance or gait caused by either a structural or a functional disorder. Some examples of causes include, but are not limited to, injury or trauma, improper shoeing, inadequate fitness, repetitive training stress, etc. While there are many sources and causes of lameness, which we will not go into depth on, it is worth noting that all bodily symptoms are interconnected. Thus, if one part of the body has soreness, it is likely a symptom of a deeper rooted problem. For example, if your horse has soreness in one of his hips, he likely has soreness in the opposite shoulder. Compensatory injuries would be that such as a horse that has received improper shoeing may have a compensatory injury to his ligaments. By evaluating your horse on a regular basis, you, the owner, can find potential problems and keep your equine athlete at peak performance levels. But as a general warning, please note that these instructions are for those with horse handling experience. If you do not know what I mean by that, please work with a certified trainer or even your veterinarian. By handling a horse without the proper experience, you may subject yourself, your horse, or others to potential harm or even death. Now, before we start, there are many things to keep in mind. The horse's age will denote their physical maturity. A 2-year-old will be much less mature than a 5-year-old. And a 20-year-old will be much more mature than a 10-year-old. This is about the difference from a child to an adult to an older person. The horse's sex is important because a female horse may experience pains or aggravations from their cycle that a male horse would not experience. There are various breeds that are for very specific jobs, and it is important that we find the right horse for the job that we are asking them to do. Their exercise schedule is important because if we are not strengthening the body and then we go ask them to run a race, we place them at a higher risk for injury. Saddle fit is important because improper fit can cause shoulder pain, back pain, and even hip pain. You spend the most time with your horse, so you know them better than anyone. And you can notice any behavioral changes in riding, such as trouble turning, sudden onset or increased aggravation, or spooking at things that they never used to. We should note anything that is out of the normal for our horse and keep an eye out for swelling or heat in any of their joints. So the first thing we're going to do is we're going to do a physical, I apologize, we're going to do a visual evaluation. So we're looking at our horse to see what we can find before we start touching them. It gives us a general idea of what area to start. This is going to be very helpful if you have a partner to help you maneuver the horse when you start with the walk and trot portion of your visual evaluation. And I will show an example of that on the next slide. So at rest, what we are looking for is balance. What do I mean by that? We're looking for over or underdeveloped muscles. They should be the same on both sides. This will show you what side of the horse is being worked more versus less. Is your horse standing square on all 4 feet? Or does he have his legs tucked underneath of him? He should stand with equal weight distribution on all 4s. You should look at the angle of his feet because this will tell you if he's receiving the proper shoeing or if there may be a weakness in his tendons. You're going to stand behind the horse and look at his hips and his shoulders. They should be in a straight line. Both hips should be the same height, and both shoulders should be equally muscled. Your horse's head should also be in line with his body. If he is holding his head off to one side, that is an indication as well. So here I have provided for you an example of having your partner maneuver your horse around for you. This horse has an obvious limp at a trot that is not noticeable at a walk. So you're going to be looking for visible limping. You're going to be looking for head bobbing. Their head will raise as they bear weight on the painful leg, and they will lower their head when they bear weight on the opposite leg. You are looking for an extended or shortened stride. What do I mean by that? Their hind foot should land in the depression of the front foot. If it does not, this is considered a shortened stride and indicates soreness. You always want to walk and trot your horse because some issues will be intensified due to the extra concussion. And thus you may see something that was not previously there. So after you have done your visual evaluation and you have decided what you think may be pain, then you can move on to your physical evaluation. This is where you're going to start checking certain points on your horse. You're going to start palpating and getting your hands on them and getting a feel for what is going on in their body. Now, before you start, there's a couple of things to consider. You will note any of your findings from the visual evaluation. You will work from their head to their tail, left side first, and then their right side. You're going to use light hand pressure, feeling for tightness or rigidity of the muscles, stiffness of joints. Pay very close attention to your horse's pain cues. For example, they may raise their head, they may pin their ears, they may swish their tail. They may look around, they may move or try to pull away from the pressure. They may twitch their skin as they would when a fly lands on them, or they may crinkle their nose. Some horses may not always show signs of soreness, and their cues may be subtle. On the other hand, when they are releasing pressure or tension, they may drop their head, they may sigh, they may lick their lips, or they may turn to look at you. They may also cock their hip, as we call it, which means they will just rest a hind foot. One other thing to consider is that they may have compensatory soreness. So I will often find that they will be sore in their jaw if they have pain in their neck, or they may be sore in their left front shoulder and also their right hind limb. So, working down the horse, you are going to check and palpate several areas. The temporomandibular joint, which is the TMJ, connects the jawbone to the skull. This one is often going to not glide properly when you attempt to move the jaw. If they have any pain or tightness throughout their body. I will next check their poll, which is their atlas and their axis, their C1 and C2 vertebrae. This is the area between the ears where the skull attaches to the neck vertebrae. I then work my way down to the brachiocephalicus muscle, which is on the bottom side of the neck. It runs from the back of the skull to the humerus, which is the top bone of the front leg. This muscle runs over the top of their cervical vertebrae. That's their neck vertebrae. Oftentimes, I will find that if they don't have a lot of range of motion in that area, or if they have tightness anywhere throughout that muscle, there is a cervical vertebrae that is out. Next, we will check the pectoral muscles, which are between the front legs. You want to ensure that there are no stress points, which we will talk about later. You want to ensure that both muscles are the same size and that center of the sternum is actually center between the front legs. Next, we will move on to the trapezius muscles, which will be the point of the shoulder. Then we will move to the abdominal muscles. That's going to be under the belly and behind the front legs. So this is where your cinch is going to sit for your saddle. A lot of the times when you touch this area, a horse will pin its ears or they will attempt to bite you if they are in pain. This is a very tender spot. Next, we're going to run our hands down their back. This is the longissimus dorsi muscle. And this is present on either side of the spine. So we're going to check both sides. Then we're going to check the sacroiliac joint. This is the point where the pelvis and the lower spine connect, under the gluteal muscles. This is at the top of the hip. You're going to check your gluteal muscles and your hamstrings. So you'll run your fingers from the sacroiliac joint down to the point of the hip and then down the back of the hip. From the top of the hip down the back of the hind limb. So as we are doing this, as we are doing our physical evaluation and palpating these points, we can also at the same time check their range of motion. What do I mean by that? Well, just like you or I, they should be able to bend their legs. They should be able to turn their neck. Their jaws, their TMJ, should move smoothly. So we're going to first check their TMJ. Why do I start here? Because this is the first major point of connection in their body that will hold tension. So I'm going to grab their nose with one hand, and I'm going to grab the bottom of their jaw with the other, and I'm just going to gently try to glide their jaw side to side. If there is any tension in this point, then I'll know that there is tension in the rest of their body. So then I'm going to check range of motion in their pole. There's C1, there's C2. This is another point in their body that tends to hold a lot of tension. Next, I'm going to ask them to bend their neck. So I'll bring their nose all the way around, and they should be able to touch their shoulder. If they cannot, then I will know that I need to probably work on their cervical vertebrae or that brachiocephalicus muscle. Next, I'm going to check their shoulders, their knees. I can do this at the same time. So I'm going to lift a front leg, and I'm just going to work my way up from the hoof, moving all of the joints, but particularly the knee, the bottom half of the leg, should essentially fold in half. There should be no space between their legs, between the two parts of their legs. And then I'll just gently glide their shoulders back and forth. And if there's any tension or tightness, then I will know that these are places that need to be addressed. I will then do the same thing with their hind legs, and this will allow me to check their hips and their hocks. Their hocks are equivalent to the human ankle, and it is often one of the main joints that tend to go out on performance horses. As we are doing our physical evaluation, as we are palpating and checking all of our points, we're going to also be looking for areas in the muscle where there will feel like small little marbles under the skin. These are called stress points. They are caused by micro tearing of the muscle fibers. This is where they are storing stress and tension. So, in conclusion, as a horse owner, it is your responsibility to ensure the health and wellness of your equine partner. This is even more important if you are expecting your horse to perform at peak levels of performance. By learning how to evaluate your horse for soreness, you'll be able to find potential problems early on before they become career-ending. Your findings will allow you to create a customized treatment plan with your vet, chiropractor, farrier, and/or massage therapist. You know your horse better than anyone. He gives you his life, so you should give him the care that he deserves.